Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the May 26, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County added 16 new COVID-19 cases since my last report on Friday, May 22nd. As of May 26, Dubuque County has 323 positive COVID-19 cases. That's a rate of 333 per 100,000 population. No additional deaths were reported, so a total of 16 deaths remain in Dubuque County. 4,850 people have been tested in Dubuque County, and about 7% of the cases tested have been positive. 10 individuals are currently hospitalized. 151 people, or about 47% of Dubuque County positive cases, have recovered to date. 797 Dubuque County residents have had serology or antibody testing. 52 of those, or 7%, have tested positive for COVID-19 antibodies. The state added 1,210 cases since May 22nd. As of May 26, 2020, Iowa has a total of 17,702 positive cases. In all, there have been 135,280 individuals tested, or 1 in 23 Iowans. And about 13% of Iowans tested have been positive. 64% of the cases are symptomatic, and another 22% are pending symptoms. 51 additional deaths were reported in the state since May 22nd, for a total of 475 Iowans. And 46% of all Iowa deaths due to COVID-19 are in those 80 years old and older. Currently, 332 cases are hospitalized around the state. And finally, 9,628, or 54% of Iowans, have recovered. Today, Governor Reynolds announced modifications to the current Iowa proclamations. Effective May 28th, bars, wineries, breweries, distilleries, and other social or fraternal clubs may reopen following the same public health measures as restaurants, including limiting normal operating capacity to 50% and social distancing groups 6 feet apart. Also, live bands or other musical performers are permitted at bars and restaurants, but must also follow social distancing protocols with members of the group and audience. Restaurants and bars may have party sizes of up to 10 people. Effective June 1st, speedways and racetracks can open events to spectators. Also, outdoor performance venues such as amphitheaters and grandstands can hold live performances. Also on June 1st, casinos and gaming facilities may reopen, as well as amusement parks, bowling alleys, pool halls, and arcades, all at 50% capacity and with public health and safety measures in place. Social, community, recreational, leisure, and sporting gatherings of more than 10 people will be permitted again on June 1st, but groups attending must maintain 6 feet of social distancing. Venues are also limited to 50% of normal operating capacity and must follow social distancing and public health measures. This also means when viewing sporting events, physical distancing and public health mitigation measures must be followed. The proclamation also permits practices, games, and competitions for youth and adult baseball and softball, and also individual sports such as running, biking, swimming, tennis, and golf, to resume with the proper social distancing and public health measures in place. Tomorrow we'll discuss what's left until the proclamation ends June 17th, in terms of limitations and closures. Stay tuned as we work our through understanding this latest state proclamation. Last week I discussed COVID-19 surface transmissibility and how likely it is to contract the SARS-CoV-2 virus from touching it. The CDC has since stated that it became clear that the edits and information on their website about this were confusing. So here's the deal. The virus spreads easily between people. How easily a virus spreads from person to person can vary. With any virus, some are highly contagious, like measles, while other viruses do not spread as easily. Another factor is whether the spread is sustained, which means it goes from person to person without stopping. The virus that causes COVID-19 is spreading very easily and sustainably between people. Information from the ongoing COVID-19 pandemic suggests that this virus is spreading more efficiently than influenza, but not as efficiently as measles, which is highly contagious. The virus may spread in other ways. It may be possible that a person can get COVID-19 by touching a surface or object that has a virus on it and then touching their own mouth, nose, or possibly their eyes. This is not thought to be the main way the virus spreads, but we are still learning more about how this virus spreads. And we know the likelihood of this type of transmission is far less than the airborne or droplet spread of person to person. In closing today, the Public Health Incident Management Team for Dubuque County continues to seek and provide testing to groups in our community with risk. We've provided testing to those identified that were contacts of positive cases, to nursing home staff, congregate living facility staff, including shelters, law enforcement, and a few others. We will continue to seek and make testing available to those individuals that have increased possibility of risk and exposure, in addition to what our local healthcare providers are doing. Keep in mind that Test Iowa is an option for anyone seeking testing, provided you're willing to take the Test Iowa online assessment and travel to a place where a Test Iowa site is set up. These are listed on the coronavirus.iowa.gov website. In the meantime, let's all continue to be safe, be smart. When in doubt, don't go out, and remember, we're all in this together.